This video's aim is to help if you are suffering with Quervains tendonitis. Quervains tendonitis is a common condition that affects the tendons that are used to straighten your thumb. It occurs more in women than men and usually aged 30 to 50 years old. Pain is worst when using the hands, for example gripping or twisting, and usually less pain when your hand is rested. The pain is on your thumb side of your wrist, discomfort when moving your thumb or wrist, sometimes heat over the area when pain occurs, restricted movement of your thumb and or wrist, swelling around the thumb side of your wrist. It is usually tender to touch in this area. Quervains tendonitis can be diagnosed by your GP or physiotherapist from the presentation of your symptoms. Usually no further investigations are required. However, these tests may help you to self-diagnose the problem. This test is limited and painful compared to the opposite side. This resisted test is also painful. If all this fits your symptoms, then you may have Quervains tendonitis. What should I do? Rest the tendon from the aggravating activity. Apply ice over the tendon. Always wrap the ice in a towel to avoid an ice burn. Take a course of anti-inflammatories unless you have been advised not to take these by your GP. Painkillers will help to control pain until it subsides. Take advice from your pharmacist. A physiotherapist can help to put a tailored exercise program together for you. A secondary effect of Quervains tendonitis can be stiffness in the wrist joint, so you should stretch this out as follows. Flexion. With your elbow straight and your hand palm facing down, bend your wrist so that your fingers point towards the floor. Use your opposite hand to apply extra stretch. Hold for 30 seconds. Extension. With your elbow straight on your hand, palm facing up, extend your wrist so that your fingers point towards the floor. Use your opposite hand to apply extra stretch. Hold for 30 seconds. Next, you need to stretch the tendon itself. Rest your forearm on a table with your thumb pointing up. Now put your thumb into your palm and close your fingers around it so that is in your fist. Now move your hand down, leading with your little finger side until you feel a stretch. Hold for 30 seconds and swap sides. All these stretches should be done little and often each day. You should try to avoid activities that irritate the area and increase your pain. Once you are settling down, then you need to strengthen the area gradually. You should start with no resistance, and it needs to be pain-free both during and after. As you strengthen the tendon, you must advance to resistance, but only if it is pain-free to do so. Ulnar radial deviation strengthening. Resting your forearm on a table with your hand palm side in so that your thumb is up. Slowly lower your hand at the wrist down towards the floor and then lift it back up towards the ceiling. The forearm shouldn't move at all throughout. Repeat 10 times and swap arms if needed. A dumbbell can be used to add resistance when ready. If you get worsening symptoms or are unsure, then initially reduce the push into the discomfort. And if this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. Remember, injuries take time to recover and do so gradually, so be patient, there are no miracle cures.